So welcome everyone to our Cecelia Health webinar this evening. A happy heart is a healthy heart is our topic. Should you have any technical difficulties, there is a phone number to call at the bottom of your screen. It's 1-800-263-6317. This is an interactive program this evening, so our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, so we look forward to an interactive webinar. Just a disclaimer, we know that the information you are about to hear may motivate you to make lifestyle changes. Please consult your physician before making any changes to your current routine. The Cecelia Health Certified Diabetes Educators will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecelia Health Certified Diabetes Care and Education Specialists. Our leader this evening is Teresa Grasso. Teresa is a registered dietitian and a certified diabetes care and education specialist. She's been working in the nutrition field for over 20 years and has specialized in diabetes care for the last 10. She resides in New Jersey with her husband and 3 girls. She leads an active life with her family as they are involved in multiple sports and activities. She's passionate about nutrition and leading a healthy lifestyle and enjoys teaching others how to improve their health. So thank you so much for being with us this evening, Teresa, and you may take it away.
Okay, thank you, Katie. Hi, everyone. So welcome tonight. Thanks for joining us. Tonight we're going to have a discussion about a healthy heart. So what we're going to look at, what is cardiovascular disease? What are the risk factors? Why do people with diabetes have an increased risk of cardiovascular disease? And then what are the steps we could take to prevent CVD? And then, of course, we're going to give you some good resources and open it up for questions. So feel free to ask questions at the end of the program. And please talk with your healthcare provider before making any changes to your diabetes treatment. So what is cardiovascular disease, or CVD is the abbreviation? So what it is heart disease and related to atherosclerosis. So when we think of heart disease, one of the big things we look at is plaque and its buildup in the artery walls. So you can see the picture here. A normal artery is going to have clear flow, so the blood can flow through that artery without being obstructed. Whereas when plaque builds up, that's basically, you can see the other picture there has some fatty deposits in that artery. So then we can see that as a diseased artery, where that artery is going to be narrow, and which makes it harder for the blood to flow through. And blood clot may form or stop blood flow, which can cause a heart attack or a stroke. So when we have the buildup of that plaque in a diseased artery, we're certainly at risk for heart attack and stroke. So what is a heart attack, and what are some of those warning signs? So a heart attack occurs when that blood flow to a part of the heart is blocked by a blood clot. If the clot cuts off the blood flow completely, the part of the heart muscle that's affected can begin to die. So a heart attack warning, somebody may have discomfort in the center of their chest, and it may last a few minutes or it may go away and come back. Other discomforts can happen in other parts of the body. So the upper arm, the back, the neck, the jaw, the stomach. And shortness of breath is sometimes a sign. Also breaking into cold sweats and being nauseous, having nausea. So you know, these are some things that can happen or signs of a heart attack. Most people do survive their first heart attack, and our goal is to prevent the heart attack. But, either way, we want to adapt lifestyle changes, which include changes to your diet to help prevent a heart attack. Or if somebody who does have heart disease, to try to heal through their diet and their lifestyle. Our other thing that can happen is stroke. So this is another thing we have to look at. Ischemic stroke is generally the most common type of stroke, and that one will happen when the blood vessels that feed the brain get blocked, and that usually is again with a blood clot. If there's an obstruction, that blood flow to the brain is obstructed, and that can cause the stroke. Um, a hemorrhagic stroke occurs when the blood vessel in the brain burst. So you can see the two different pictures there, and the types of strokes that can happen. Typically, this type of stroke can most likely be caused by high blood pressure. So high blood pressure, getting that under control and staying on top of our blood pressure, making sure it's at a good level, is a very important piece in preventing strokes. Um, so with a stroke, you may have sudden numbness or weakness in the face, the arm, or your leg, especially on one side of the body. Someone could have sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes can be a sign of a stroke. Sudden trouble walking, dizziness, loss of balance, or lack of coordination, and a sudden headache with no known cause. So you could see, with a stroke, a lot of things can happen suddenly. So you want to be aware of what those what these symptoms are. So if for any reason you or someone may be suffering from a stroke, we want to act fast. And we use that word fast as an acronym because these are some things we want to remember. So we want to act fast, and then we want to use that acronym. So F is face. We want to look at the person. A good thing to do is ask that person to smile. Does one side of their face droop down? So if they go to smile, is only one side of the smile going up and one's going down or not moving? You want to use the letter A for arms. Ask the person to raise both arms at the same time. Do both arms go up at the same time, or does one start to drift down? That could be a sign of the stroke. S would stand for speech. So we want to ask the person to repeat a simple phrase. Is their speech slurred, or does it sound strange to you? That's a sign. Time. So time is essential with a stroke. So that's why we use that fast. We want to act fast. We want to look at this acronym. If we observe any of these signs and symptoms here, we want to call 911 immediately and act fast in a stroke. Okay. Other types of CVD or cardiovascular disease, heart failure. You might often hear of this as congestive heart failure or CHF. So the heart just isn't pumping blood as well as it should. So with that, then the body's need for blood and oxygen is not being met. A lot of times people with CHF have a lot of fluid on their body because their heart is just not working as it should. Arrhythmias are something else that can affect the heart. So that would be an abnormal rhythm of the heart, and it's going to affect how well the heart works. So there's generally two different types. Bradycardia, you may hear, that's when somebody's heart is beating too slow. And then you may hear tachycardia, that's when somebody's heart is beating too fast. So both of those are types of arrhythmia that would need to be treated and looked at. Heart valve problems. Maybe a heart valve doesn't open or close properly. those are issues related to CVD. Okay. And then there are many risk factors. So some of these risk factors we can't control. Some of them are risk factors that are just part of us, like our age. As someone ages, their cardiovascular system can become weaker. So age may play a factor in your risk factor for CVD. Genetics is also a risk factor. So again, we can't change our genetics, but that can put people at risk. So people who have direct family members that maybe have had a heart attack or have heart disease, they're at a higher risk of developing it themselves. Somebody's gender. So men are 3 to 5 times more likely to develop heart disease than women. So the gender does put you, a male gender does put you more at risk. Then we can look at some of the things that we can change to help prevent that heart disease, or if we're doing some of these are things that we can change to help protect our heart and to make our heart healthier, as that's what we are aiming for. So smoking can play a big role in heart disease. Nicotine and carbon monoxide is going to increase somebody's heart rate and lower the oxygen levels in the heart muscle. So, a lot of times with smoking, we think of it as it can cause lung disease, and people forget about what it can be doing to the heart and the overall oxygen levels in the body. So smoking cessation programs are widely available. In New York, you can dial 311 and get to a smoking cessation program, because it's important to, if you are smoking, to quit smoking to help with protecting your heart. Lifestyle. So everyday life can be stressful. So stress can play a role. Um, Not getting enough exercise, having a sedentary lifestyle can play a role in heart disease. So we're going to talk more about that, but it's important that we get that body moving, that we have activity in our lifestyle. Diet. So we all know that diet plays a big role in heart disease, and we will get into that more. But a diet that is high in fat, high in salt, high in sugar, that can affect our heart. Consuming too much alcohol can put you at risk. Any high blood pressure is going to put somebody at risk. So we'll talk more about that, and what we need to do in our diet to keep our blood pressure at a good level. And then diabetes does put us at risk for CVD. There's tons of statistics that, clearly speak very clear to say that there's a strong correlation between heart disease and diabetes. So the two together, we need to look at managing both of those, particularly hypertension, and we're going to look at managing our blood sugars too. All of that together is going to help with keeping our heart healthy. So cardiovascular disease and diabetes, I said the statistics speak clearly, and here is a little bit information on that. So at least 68% of the people age 65 and older with diabetes have some form of heart disease. Adults with diabetes are 4 times more likely to have heart disease or a stroke than adults that do not have diabetes. So we can see that diabetes can really affect the heart. 16% of people with diabetes in that 65 and older range can die of a stroke. And the American Heart Association considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease. So this is where it's important that we look at our diabetes and get that under control. Look at getting those blood sugars to a good level and our A1Cs to a good level, which is also going to help with protecting our heart. So it all kind of works together in keeping our blood sugars in control and keeping our heart healthy. Okay, so why are people with diabetes at a higher risk? Um, so a couple things. High blood pressure. So we mentioned that, but a lot of people with diabetes also have high blood pressure. So that's going to put them more at risk. Abnormal cholesterol levels and high triglycerides. So if you've ever, everybody should have their cholesterol, their lipid profiles done, and there's always going to be a breakdown in that lipid profile where you'll see what is my total cholesterol, and then there'll be your HDL cholesterol, which is uh, our good cholesterol. So that one we look at, it helps protect the heart. So we want that one to be a little bit higher. Then we have our bad cholesterol. So the the high LDL is the unhealthy cholesterol, and then it's broken down a little more. You may see the low, um, in your blood work, you'll see the LDL, and sometimes there's a little breakdown to that, and then the HDL. Sorry, that was a little confusing there. So your HDL is your good cholesterol, and we want that to be low. So that's the healthy cholesterol. The LDL is the bad cholesterol, which is unhealthy, and we want that to be low. So HDL high, LDL low. Um, and those numbers, you can go over with your doctor. There's different ranges. Generally, HDL for we want it over 40. LDL, they look at, different ranges on what's going on, but somewhere around 100 or so. And then triglycerides are another part of that lipid profile. Triglycerides are often, if those are high, we look at sugar sometimes in our diet. So again, that can go back to the diabetes and following a carb controlled diet. Too much carbs and sugar can raise those triglycerides. So we don't only look at the fats in our diet for those. We also have to look at the sugars in our diet. So those are all numbers we want to look at. If those are not within range, that can affect us. Obesity, so being overweight, it can put us at risk. And particularly that insulin resistance. As I mentioned before, lack of physical activity. So not having an active lifestyle can raise your risk of heart disease, and it can also contribute to blood sugars going up. And then general increased inflammation. So these are some things of why people with diabetes are more at risk for that cardiovascular disease. So what can we do to lower our risk? So, some things we want to look at is eating healthy to help lower our blood pressure and our cholesterol levels. Losing weight can be helpful in lowering our risk. Definitely quitting smoking, getting more exercise in, and then managing your diabetes. So again, we'll talk about those a little bit more. So first being that blood pressure. So we know that high blood pressure can double our risk of stroke if it's uncontrolled. So we want to monitor our blood pressure, and we need to seek treatment if that blood pressure is high. So maintaining a blood pressure of less than 140/90 is ideal. Blood pressure, I'm sure you've heard people and different things say blood pressure is the silent killer, hypertension is a silent killer, because we don't necessarily feel blood pressure. Somebody's blood pressure may be high and they may not have any symptoms of that. So it's always important to keep up with your regular care with your primary doctor and get that blood pressure checked. If you're on blood pressure medications, you never want to stop them without speaking with your doctor. Even if we're feeling good, a lot of times we need to just talk over our care with our doctor because we're looking to keep that blood sugar at a good level, maintaining it at that 140 over 90. So if we look at our diet, one thing that we know we can do with our eating and our diet is to limit our salt intake or our sodium. So with high blood pressure, we're looking to reduce or limit our sodium to 1,500 milligrams per day. So 1,500 is about a half of a teaspoon. So what we want to think about is we definitely want to try to stay away from adding salt to our foods. Once we start adding that salt shaker, that can really increase our salt consumption. So many foods already have sodium in them. A lot of them will know. We know if we had a canned food or, maybe potato chips or pretzels that have salt on them, we automatically know, okay, this food is high in salt. But there are a lot of foods that have hidden salt that we might not think about. Maybe bread being one of them. So bread has salt in it, so we might not think about that. So a bagel, that's something that can have a lot of salt in it. It might not taste salty. A slice of bread might not taste salty, but there is that sodium in there. So looking at food labels is important. One thing that's always important if you're watching your blood pressure or watching our salt, so we want to look at that sodium on your food label. Some of the American Heart Association does have a list of what are the 5 salty foods, and these are good to know because those are ones that you can kind of say, oop, I don't know if I really should be eating this, or maybe I should be looking for a lower sodium variety. And those 5 salty foods would be processed meats. So think of cold cuts and bacon and ham. Those are high. Pizza is in the top 5. Canned soup, sandwiches. So we spoke a little bit about that. Burritos and tacos. So the Mexican food, burritos and tacos are high in salt. And then, as I mentioned before, the bread and the rolls. Oh, that was 6. So the salty 6. So those are some things to think about with the salt. Another thing we want to think about, we often talk about what are things we need to get rid of in our diet. So we know we have to reduce that salt, but a good way to think is what should I be adding to my diet? What should I be adding that's going to make my diet healthier and help protect my heart? And one of those things is fruits and vegetables. So we really should be eating about 4 or 5 cups daily, where that the breakdown of that may be like 2 cups of vegetables in a day. And then maybe you have 2 to 3 pieces of fruit spread out throughout the day. We know fruit has sugar. It's healthy. We're not going to eat those 2 or 3 pieces at one time, but if we're spreading them out, we certainly can include it in our diet for diabetes. And we certainly need to get those fruits for the fiber and the vitamins and minerals that are in them that are going to help with protecting our heart. So a good way to think about our plate when we eat is using that food plate or my plate, where if you take your plate and split it in half, you want half of your plate to be your vegetables when you're eating. So whether that's cooked vegetables, broccoli, cauliflower, green beans, zucchini, eggplant, or raw vegetables like a salad or cucumbers, tomatoes, whatever it is, half of the plate should be vegetables. Then our other half of the plate, we're going to split. Quarter of it we want to be our whole grain food, our carbohydrates, maybe our brown rice or our sweet potato or a small potato or whole wheat pasta or quinoa. And then the other quarter of the plate would be our lean protein. So we want to try to think of more chicken, fish, any other meats. We want to make sure they're lean. And we want to make sure we're doing low-fat cooking methods, baking, broiling, grilling, not adding more fat to those. So that's a good way to think about it. Think of your plate and your diet as being colorful. So adding those fruits and vegetables. And then exercise. So we want to try to get or aim for about 30 minutes of moderate to vigorous exercise, at least 5 days a week, or look for a total of 150 minutes per week. So whichever way it's easier for you to look at it. Good to maybe evaluate what you're doing now and see where can maybe I add a little bit more. Um, if you can't do 30 minutes at one time, that's perfectly fine. 15 minutes and then 15 minutes later on, that will add up, and we want to think of getting that body moving however we need to do it. So walking is very good. Um, Getting in a walk each day. If you have um, any kind of injuries or something where you can't do a lot of cardio, you can even just do chair exercises where you're using a chair for support, sitting in the chair. The main goal is to get the body moving. Whenever you can, add in a little bit of an extra walk. If I'm watching TV, maybe I'm doing a little bit of leg lifts or arm circles, things that'll get my body moving. We mentioned this a couple times, but quitting smoking is very important, and then always taking our medications. So we need to talk to our doctor. If our doctor prescribes our medications for us, we need to take them. If for any reason something with your medication is bothering you, you want to talk to your doctor about it, and maybe something needs to be adjusted, but we never want to just stop our medications without speaking to our doctor. So obesity, we know, plays a role in heart disease, and is linked to blood pressures going up and blood sugars going up. So all of these can raise our odds of having a stroke. Try to break it down. Everybody's different in what their goals are and what they need to do. So I often hear people say like, oh, I need to lose 70 pounds. I'm never going to be able to do that, or whatever the number might be. Try to think of it in much smaller increments, because you want to have a goal that you can be successful at, and maybe 70 or 20 or 50, whatever it might be, is a little too much for you to grasp, or for anybody to grasp, because it's not easy, and we know that. So thinking of as little as 10 pounds, or even starting smaller. I'm going to lose 5 pounds in the next 6 weeks. Set a smaller goal that is more achievable. So then once you do that, then you could say, okay, now I'm down 5. I'm going to make my next goal 5 more pounds. And then you can just think of it in slower increments. And a lot of times that is more, we're more successful at that because it's more achievable for us. And then really losing as little as 10 pounds. And again, I don't want to say little and mean that that's easy. 10 pounds is still not easy to do, but we have the tools, and eating healthy and exercising, and those are things that can help us get that weight down. But every little bit can help, and as little as 10 pounds can really make an impact on reducing your risk of a stroke. And if we can, we try to keep our body mass index at 25 or less, or in the healthy body mass index range. Again, this is, everybody's body's different. The scale is not perfect. If you know what your BMI is, make small steps. So let's just say my BMI is a 30. I might say, okay, my goal is to get my BMI from a 30 to a 28. So you just make small increment changes, and that is all going to be helpful. And then once you reach that goal, then you can set your next goal, and then hopefully get to that healthier BMI. Working with a registered dietitian is something that you can do that can help you achieve your weight loss goals. And a good website to look at is eatright.org. You can go on that website, you can search for a dietitian in your area. You can do that, or certainly if you're on one of our Cecelia health programs, working with your coach if weight loss is something that you would like to achieve, make sure your coach knows that and you guys can work together to help with that weight loss. And moving, I know we said this before, but it is important. A lot of times we're just too sedentary and we need to make activity a part of our everyday lifestyle. So getting up and moving when you can is so important. Blood sugar management. So we want to make sure we have blood sugars that are in control. If our blood sugars are continuously high, that can damage our blood vessels over time, and that may make a blood clot more likely to occur. So you want to check your blood sugars as directed by your doctor. Um, if you should have a meter at home to check them. And what you want to do, a good time to check is first thing in the morning. Um, so a lot of times, one, that's a good time to know when I wake up, what is my blood sugar? We want to see, you went through the night, what is my blood sugar when I wake up? Our goal in the morning is blood sugars between 80 and 130. So that is a really good time to check to see, am I within that range? Am I in between that 80 to 130? And that's a good indicator that I'm controlled at that point of the day. Another good time to check is 2 hours after we've eaten something. So I want to see, what is my blood sugar after I have a meal. And at that 2 hours after point, the goal is between 80 and 180. So that is a little bit higher after we eat, because obviously we have food on board. It's understandable that blood sugar can go up. But just talk to your doctor about blood sugar monitoring and keeping those blood sugars within a good range. And then, of course, our A1C that we get done, the blood work that the doctor will typically do every 3 to 4 months. The A1C is a good indicator too of how am I managing my blood sugars. So our goal with diabetes is to have a A1C around 7. We look for it to be right around that 7, and that tells us that we're controlling our blood sugar. It's one indication that we're controlling it. We may look at the finger sticks and that and everything together, but those are numbers that we need to know. And, with diabetes, we know it's not just one thing. We want a combination of our diet, our exercise, and our medications all working together to keep our blood sugars within a good range. So quit smoking. I know I've said this several times, but you can stress the importance of it. Um, you can ask your doctor on advice on how to quit. There's different kind of aids, which, nicotine pills and patches and counseling. There's tons of programs. So again, just, seek that out from your doctor or your coach to help you if smoking is something that you're doing right now. Okay, so these are some of our resources. The American Heart Association is a really good resource to use. Heart.org, there's really good recipes on there and information, whatever it is that you're looking for, but tons of stuff that would be helpful. The National Heart, Lung, and Blood Institute, again, lots of good information on there. The CDC, you can just do cdc.gov/heart disease, and you can get a lot of good info on there. The American Diabetes Association, it's going to have good resources for you with your diabetes and certainly heart disease, and then the nutrition.gov website. So, those are some of the things we want to think about with with heart disease and protecting our heart and a healthy heart. So what we want to think about is diet. I'll just put that one back in case you want to look more. We're thinking of our diet. So how am I going to improve my diet to help my heart? I'm going to start watching the salt in my diet. If you're somebody who uses that salt shaker, that's the first thing I want to try to do. I want to um, reduce the use of the salt shaker. I want to maybe think about using different herbs and spices, garlic, onion, pepper, whatever kind of seasonings you like, basil, oregano, Italian seasonings, those kind of herbs and spices that don't have sodium in them. We want to use those to flavor our foods. The Mrs. Dash has a good line of products that are going to be low to no salt, and those are good to season our foods. So sodium, look at the foods that we're eating and how much salt is in them is important. We want to look at the fats in our diet too. So saturated fats, which may be in things like whole milk products, cheeses, animal foods. So any like fatty red meats and pork and that can have a lot of saturated fat in it. So you want to try to choose lower fat products. Like I said, the lean meats, more chicken, take the skin off the chicken, more fish. Salmon is a really good fish because it has omega-3s in it, and omega-3s are a heart healthy fat. So um, including more omega-3s in your diet is helpful too. So salmon, if you like fish, is a good choice. Having fish two times a week is good because that's a nice lean, healthy protein that you can have with your meals. There's also plant-based products that have omega-3s in them. So flaxseed is a type of seed that is high in omega-3s. You need to get it ground up or grind it up because if it's the whole seed, our body actually doesn't digest it. But ground flaxseed is something that you could maybe add to your foods. Putting it in a smoothie or maybe sprinkling it on a salad or using it on oatmeal. Those are some ways you can kind of incorporate a little omega-3 that way. Walnuts have omega-3s in them, so they're a type of nut that's high in omega-3, so including maybe a little walnuts in your diet is a way to get that healthy fat in too. And one thing I didn't mention with those cholesterol levels, exercise is going to help those too. So if LDL is high, that bad cholesterol, exercise can help with lowering that. And exercise can also help increase that HDL, that good cholesterol. So, another reason why we want to get that body moving. So diet is important. Quitting smoking if we're smoking, and exercise is going to be super important. And then just making sure you're following up with your doctor too. If heart disease is something you have, or if you have high blood pressure, if you have diabetes, making sure you're keeping up with your appointments and keeping up with your preventative appointments. So if the blood pressure is going up, we want to make sure that and the doctor knows, and adjustments can be made to your diet, you maybe your medication to keep everything under control. So those are some of the things we want to think about. So we will open it up now for discussion, questions and answers. So you can use the question tab on your toolbar. If you have a question you'd like us to discuss. So if anybody has a question, I'm just trying to see if there's any on here. Okay, so if you do have a question, just feel free to type it in. I see one here. I always have trouble seeing them. It's so small. Okay, BMI is something I disagree with. Everyone has different bodies. Agree. So I know I went through that quickly. So BMI is, it's a scale. It's something used as, a point to kind of look at. So when I was talking about that before too, is everybody's body is different. You're right. Just like you said, everybody's body's different. People have more muscle, you know, the BMI kind of lumps everyone together. So it is by no means a perfect scale. It's lumping together, men, women, older people, although there is a BMI chart for older people now. But it is lumping everyone together and not taking into account their bone structure, their muscle mass, their body size. So that's why I don't want you to get so hung up on those numbers. And I really don't like saying that, oh, your BMI should be right here. Yes, the BMI puts us at risk. So the higher we are on the BMI scale can increase somebody's risk of many different things, but heart disease being one of them. But that's why one way to think about it is just trying, if you are overweight, just trying to move down a little bit is going to be helpful. So, not necessarily just focusing on that BMI number, but losing that 10% of your body weight or 10 pounds, whatever it is, and moving that BMI down anytime we move it down. So again, if we went from a 30 BMI and we went down to a 28, 28 is still in that overweight range per the scale, but it may be a perfectly comfortable, healthy weight for that individual. And it's much better to get to a weight that somebody can stay at and maintain. So if somebody's losing weight, I wouldn't necessarily tell people, oh, you need to be all the way down here. That might not be ideal for them. So any movement down that's going to help them and maybe help improve their blood sugars or their blood pressure, their cholesterol levels. And then if it helps improve that and they can maintain that weight at that lower weight, that's going to be better for them as a whole. Better than if they're kind of swinging their weight up and down. One time it's high, one day it's low. We want to just get to a point where we're comfortable with our weight, and hopefully it has helped improved some of our health conditions by slowly getting it down. So I hope that answered, or I am in agreement with you on that one. Um, all right, any other questions? I think something's in there. Give me 1 second. I'm just trying to make it bigger. Oh, why? I saw something that said cardiologist, but now it's not. Okay.
Hey, Teresa, if you can't
Yeah.
see it, I can read it to you.
Okay.
Do you want,
Was it
can you see it?
okay. Cardiologist for a yearly, is that where it starts?
No, it goes, I can read it aloud to you.
Okay, yeah,
Want
if
me
you
to?
can read it, because
Okay, sure. I know sometimes they're hard to see, but it says, I have diabetes, heart disease runs in my family. My blood pressure has always been good. Is it wise to see a cardiologist for a yearly check, or are checks with family doctor and endocrinologist good enough?
okay, so I, I would definitely speak to your primary doctor and your endocrinologist about that. Sometimes if, like you said, it runs in your family, you have your blood pressure is good right now. So just speak with your doctor, because there may be certain tests that the doctor may want to run. Sometimes they do like a EKG on your heart just to see if there are any of those arrhythmias we talked about, or, depending what's going on, you again talk to your doctor about that, and then they would refer you to a cardiologist if needed. So depends too, like how much of a family history and what that family history was. Sometimes if people had heart, say you have people in your family who had heart disease when they were very young, that might be an indication that your doctor may say, okay, we want you to see a cardiologist, the expert, um, because that might not be something that might be something they want you to get maybe a little more testing done, and just to see, make sure, and if there's nothing, to see if there's anything else going on with your heart. But if your blood pressure is good, you're following up with your doctor, you may not need to see a cardiologist, but definitely speak to your doctor about that, because the doctor has your whole, or let them know your family history and what type of heart disease there was, and then that will help them make a better determination if you need to see the cardiologist or not. Okay, so I hope that answered that, but feel free to write more if you have any other questions. Okay, so somebody's asking about fiber and heart disease. Um, that, they see that fiber helps with lowering cholesterol. So that's something you may see on a lot of food products that you're buying, that heart health symbol. Um, so cholesterol, fiber has been shown to help lower cholesterol, and that's really why they're allowed to say that, make those claims, because it has been proven. So basically what fiber does is it helps attach to cholesterol in the body, and it helps our body like get rid of cholesterol. So having a diet high in fiber is a good thing. Um, so choosing, like we mentioned before, having vegetables and fruits every day, they're going to give you some of that fiber you need. Using whole grain foods, so trying to stay away from like processed white flour products, white breads, white rolls, white pasta. Trying to make at least half of your grains whole grains. So look when you choose a grain that it's either says whole wheat or whole grain. When you look at the ingredients on a bread product, you want that first ingredient to say whole grain or whole wheat or oats or whatever. If that first ingredient says enriched, so if it ever says enriched flour, um, then it's not a whole grain. So then it's more processed. So like a white bread, you're going to see it says enriched. Sometimes even bread that looks like it's wheat and it's brown, you might think it's a wheat bread, but it's not. So you're always looking at that label, and you want that first ingredient to be the name of a grain or whole grain. You don't want it to be enriched. And then that whole grain food is going to have more of that fiber in it, which is important. So again, you will see certain foods that have a heart healthy symbol on the food product. And then that food, if it has that heart healthy symbol, it's low in saturated fat, it has fiber in it, and it is a healthy choice. And that would be something to kind of include in your diet. Of course, portion control we always look at. So let's just say it was a cereal. Some cereals, Cheerios I know is one. different oat products, they're going to have that heart healthy symbol on there. And you just want to look at the portion. So just because it's healthy, we still have to watch how much we're eating of something. So look at that serving size on the label and make sure, you're just controlling your portions, but certainly including fiber in your diet is a good thing. And we look to get somewhere around 25 to 30, 35 grams of fiber per day. So that's something else that we can think about when we're thinking about a heart healthy diet. Okay. So just a question about the sodium. Um, so somebody with high blood pressure, there's also, so normally we might say, or you might see things about sodium and it's saying that 2,300 milligrams or less per day. And that's if we're watching and eating healthy. But if we already have high blood pressure, um, and really age, if we're over 65 years of age, another thing is if we're African American, those are some things that we want to be careful because we're more at risk of high blood pressure. And then we want to keep that sodium to 1,500 milligrams a day. So that's where the difference comes in. So we want to do a little bit less than that teaspoon of salt. So a teaspoon of salt is right around that 2,400 milligrams. So we need less than that. And a good thing to look at, again, with that food label. So food label's, really important for sodium. If you look at your serving size, then look at the sodium. A good rule is anything over 300 milligrams. Kind of think about it. Think, okay, what is this that I'm eating? Am I going to keep it to that one portion and only have the 300 milligrams? If I double my portion, then I'm doubling that sodium. So I want to be really careful. So anything that's 300 or more, that would be a good indication to say, okay, let me really think. I'm going to need to watch my portion, or maybe I need to choose something else. On a food label, anything that's 140 milligrams or less, that's considered a low sodium food. So you can find low sodium foods. Again, watch the portion size because even if it's low sodium, we got to look at our serving size. Be careful of things that say reduced sodium. Just because it says reduced means it's reduced from the original amount. It's reduced by 25%, but it still can be high in sodium. Canned foods, you can find ones that say no added salt, and those would be lower in sodium than ones that say reduced. Reduced can still have a lot of salt in there. Okay. All right. Any more questions? So if anybody has any, they can pop them on there. In the meantime, just wanted to give you some information on our other upcoming live events. So if you're interested in any of these events that are coming up, you can let your coach know. You can go to the link, and the next one next month is Diabetes 101, which is Mastering the Essentials. That's on the 20th, and it's also at 6 p.m. And then we have Embracing the Holidays. So that one is going to be in November, and that one is Embracing the Holidays Without Deprivation. So healthy eating strategies for every festive eater. So that's important with the holidays coming up. A lot of people's schedules are busier and there's a lot of food around, centered around a lot of, activities and events. So, it's important to think about that ahead of time and think about what we want to do to continue healthy eating through that holiday season. And that one is going to be on November the 9th, and it is at 5 p.m. So those are the ones we have coming up. Okay. Okay. So, you can always speak to your coach whoops, about attending more of those events. So there's usually one per month. So you can always pop onto them whenever you're available. We also do have some of the pre-recorded ones. So you can ask your coach about that if there's one that you missed or a topic that you think you might want to listen to. We have some of those pre-recorded ones you can. We do have text messaging available. So if you haven't signed up for text messaging, ask your coach because they can also text you this information. And then if you're on Facebook, we have some great diabetes information. Our blog is on our website and then also on the Facebook page. You can go to the Cecelia Health Coaching Facebook page and you can get a lot of good information on that page too. Okay. So if there's no more questions, I just want to thank everybody for attending. We appreciate your attendance tonight and for participating in the webinar and asking questions. And thank you so much for being with us, and definitely come back to some of our other great sessions so you can just keep learning and participating and learn more about your health. Have a good night, everyone.